The second phase of India's COVID vaccine drive is receiving an enthusiastic response. However, if you are on medication or recently recovered from some serious illness or even COVID-19 for that matter, you may have some questions that we are about to address in this video. First, let's talk about the two vaccines that are available in India. These are Covishield and Covaxin. Covishield is made by Serum Institute of India and developed by Oxford and AstraZeneca. Covaxin is developed by Bharat Biotech. Is any one of them better than the other? Both vaccines have been made in India following all protocols. The only difference is Covishield has passed through all the 3 stages of trial. Covaxin was still in the last clinical trial stage when it was approved for emergency use. On Wednesday, Bharat Biotech finally had an efficacy data that was pending. It said, Covaxin has demonstrated an interim vaccine efficacy of 81% in phase 3 clinical trials. It is hoped that this finding will now eliminate vaccine hesitancy among Indians. The next question we address is who should not take the vaccine or defer its administration. Here are the don'ts for Covaxin. Do not take Covaxin if you have a history of allergies, fever, a bleeding disorder, either you're on a blood thinner or are immune compromised or on medicine that affects the immune system. If you're pregnant or breastfeeding and you have already received another COVID vaccine, any other serious health issue as determined by the vaccinator, you do not take Covaxin. You do not take Covishield if you have allergic reaction after the first vaccine dose or you are allergic to the ingredients in Covishield. Serum Institute has further said that those with blood disorders or who are on blood thinners should avoid the vaccine. But the ICMR said that such patients can take the vaccine, like those who are on antiplatelets like aspirin and clopidogrel. Those on anticoagulants like heparin or newer oral anticoagulants can stop the medicine few days before vaccination. Persons with COVID or who've recently received plasma therapy or who have serious illness must defer the vaccine by 4 to 8 weeks after their recovery. Side effects are normal and expected. Some common side effects are fever, tiredness, and pain at injection site. There are more common side effects, but remember these are not reasons to be alarmed. And let me elaborate. You can experience pain, warmth, itching, bruising, fatigue, chills, fever, nausea, muscle ache, lumps, and general discomfort or malaise. It is recommended that you stay at the vaccination center for about half an hour after you receive the shot and inform the nearest health authority if you feel any kind of discomfort subsequently. Even after vaccination, you must follow COVID-appropriate behavior like wearing masks, social distancing, and hand hygiene and general sanitization.